All right, good. So one more time, good morning.
Good morning.
Thank you for joining us as we share an update on Cook County's Medical Debt Relief Initiative, or MDRI. Before we begin, I want to recognize a few people who helped make today possible. Commissioners Vasquez, Aguilar, and Stamps, thank you all for your support. Courtney Werpy-Story, Vice President of Government Initiatives at Undue Medical Debt. Dennis Anosike, did I say it right?
Yes.
Okay, good. Executive Vice President and Chief Financial Officer of St. Anthony Hospital. Thank you all for joining us. Though they're not speaking today, I'd also like to acknowledge Matt Richards, our Deputy Chief of Staff for Health, for his leadership in this program. I also want to thank Todd Schubel and the Bureau of Technology. Their GIS team helped us visualize the impact through the maps on display today. We're here this morning to share some truly remarkable news. Since launching MDRI in 2022, Cook County has now abolished more than $664 million in medical debt. This relief has reached over 550,000 residents in Chicago and suburban Cook County. So let me say that again. Over $500 million in medical debt forgiven, over 500,000 people helped. That means that 1 in 10 Cook County residents has received relief through this initiative. At a time when working families are being squeezed by rising costs, including housing, health care, and everyday essentials, this kind of support provides real and immediate relief when it's most urgent. We are stepping in where the system has failed and where families would otherwise be left to shoulder these costs alone. This is what it looks like to put public dollars to work for the people who need it most. As I've said repeatedly, what we need in this country is universal health care.
That's right.
And until such time as we have it, we have to pursue measures like this one to create as much equity as we possibly can. We achieved our results by investing $9 million from our American Rescue Plan Act, or ARPA, into a partnership with Undue Medical Debt. Through their model, MDRI has canceled eligible debt automatically and at scale without red tape or bureaucracy, which often prevents help from reaching people who need it most. This is what government can do when we focus on delivering meaningful relief with urgency, compassion, and equity. But let's be clear, medical debt doesn't just affect your bank account. It can keep people from seeking treatment, destroy credit, and leave families feeling stuck, even when they've done everything right, everything. That's why this initiative is so important. It gives people room to recover, not just from illness, but from the crushing weight of medical bills that linger long after treatment ends. But MDRI is not just a one-off program. It's part of a broader intentional strategy to center equity in our policymaking and provide real support to low-income and working-class residents across Cook County. The map beside me was created by our Bureau of Technology's GIS department. It shows zip codes where this debt relief has been most concentrated. And for many of you, this map may be familiar. I often say we have one map in Cook County, one map, because when you pull together maps that measure educational attainment, economic status, or life expectancy, you invariably see the same picture. It's the same map. That map shows that across the south and west sides of Cook County, areas where we've abolished the most medical debt, are the same communities that suffer most from poverty, have the most under-resourced public schools, and have the least access to healthy and affordable food, quality health care, and convenient and reliable public transit. They're challenged in a myriad of ways. Through MDRI and through our Guaranteed Income Pilot, and now coming up our Homeowners Relief Fund, we're working to change that map. We're choosing to invest in residents who have historically been left behind. We're using every tool available to build a Cook County where equity is not just an aspiration, but a reality for our residents. That's the vision. And days like today show what's possible when we stay focused on it. I want to thank all of our partners, including Undue Medical Debt, St. Anthony Hospital, and the many hospital systems that have stepped up to make this work possible. If your hospital or provider group has not yet joined us, we invite you to be part of this effort. By working together, we can reach more families, remove more barriers, and make Cook County a place where medical emergencies do not become a financial crisis. Now, I want to acknowledge Nish Didakavi, who's in the back here. He and Mara Hennigan brought this idea to us as part of our American Rescue Plan Act initiatives. Mara's gone on to bigger and better things. Nish, bless him, is still with us, so I want to thank him while he's here. So this is what it means to lead with equity. This is what it means to build a government that truly works for the people. Thank you. Now, I would like each commissioner, thank you. I'd like each commissioner to introduce the person who follows them. We'll begin in alphabetical order with Commissioner Aguilar.
Thank you, Madam President. Thank you, my colleagues. First, I want to thank President Preckwinkle for her leadership on this effort. Medical debt is probably the number one reason why people get bankruptcy. But I got a little story to tell you. Sure. When this came out, I reached out to a few hospitals in the area, and they couldn't believe it. Paid that. So now they believe it. Okay. So thanks. It's coming. So glad to see that people are out of debt. But healthcare should not be a privilege, especially in this country. I mean, third world countries have national health care. And hopefully this is the beginning of something through a president's office and colleagues at a blueprint to future. And hopefully someday we're going to have national health care where every single human being, because this is an issue of life and death, live or die. That's what it's all about. So again, I want to thank my colleagues on this effort, and let's just keep doing what we're doing. So thank you.
Thank you.
Okay. I'd like to do my colleague, Commissioner of the 1st District, Commissioner Stamps, Tara Stamps.
Thank you. Good morning.
Good morning.
I want to thank President Preckwinkle and my fellow commissioners for their bold leadership in addressing one of the most pressing issues facing our communities, medical debt. I'm proud to stand here today representing the 1st District, where too many of our neighbors have had to choose between paying rent, paying bills, or paying hospital bills. Medical debt is not just a financial issue, it's a public health crisis. It prevents people from seeking care, it creates undue stress, and traps families into cycles of poverty. Cook County has the president gave the results, 13 residents with credit record have medical debt in collections. Alarmingly, 19% of black residents are affected, compared to 8% of white residents, highlighting a significant racial disparities. So today we are taking a stand that no one should go bankrupt because they got sick. This initiative is not just charity, it is a step toward justice and equity. Medical debt disproportionately affects our most vulnerable, low-income families, communities of color, and the uninsured. By eliminating this debt, we are not only providing financial relief, but also restoring dignity and hope to our residents. Let us begin this broader movement. Cook County is leading the way, and we urge others to join us in this fight to end medical debt. Together, we can build a more equitable, compassionate healthcare system for all. And now I would like to bring up our most recent addition to the commission, the Board of Commissioners, Jessica Vasquez.
Good morning. My name is Jessica Vasquez. I'm 8th District Cook County Commissioner. Today's announcement is a powerful example of what government can do when we prioritize people over profits. $664 million in medical debt, relief to over 500,000 residents. Thank you, President. Thank you, commissioners. That's not just a number. That's a mother who can sleep at night, a senior who can finally schedule follow-up care, a family who no longer has to choose between groceries and hospital bills. By investing 9 million of our federal recovery funds, we've wiped out hundreds of millions in debt. That's smart, compassionate policy with a real return on investments. It is a model for the rest of the country. Medical debt is not a personal failure, it's a systemic failure. And through this initiative, Cook County is saying to our residents, to our families, we see you, we've got your back, and we are not done yet. Thank you.
Now I'd like to bring to the podium Courtney Werpe Story, Vice President of Government Initiatives at Undue Medical Debt.
Good morning, and thank you for having us here today to announce another round of debt relief for Cook County residents. It is an honor to be here with you, Madam President, and the commissioners. We are so grateful to be partners with you guys in this work. My name is Courtney Story, and I am the Vice President of Government Initiatives at Undue Medical Debt. I want to start by thanking Cook County for its leadership in addressing medical debt. Cook County was our first government partnership in 2022, and we are so proud to partner with you and grateful for your commitment to this work. We are thrilled to announce another round of debt relief for Cook County residents today. In total, as you've heard, we've abolished nearly $665 million in medical debt for over 500,000 people in Cook County. Nationally, more than 100 million people struggle with medical debt, including thousands here in Cook County, where according to the Urban Institute, the average person with medical debt has a balance of nearly $1,200. And since half of adults in this country report not having $500 on hand for an unexpected medical expense, we know that that is no small burden. Medical debt is not a debt of choice. It is a debt of necessity. No one asks to get sick or injured, but for too many people, a trip to the hospital turns into financial distress. Medical debt forces people to delay care, it can impact credit, and it weighs heaviest on communities that are already facing inequity. At Undue Medical Debt, our mission is simple: eliminate medical debt for those who need relief the most, so that one day we are no longer needed. Our model allows us to purchase debt in bulk, directly from hospitals, health systems, and the secondary market. Individuals qualify for relief if they earn up to 400% of the federal poverty level, or if their medical debt exceeds 5% of their annual income. Once acquired, the debt is simply erased. There is no application, no red tape, no strings attached. Individuals are notified by letter that their debt has been abolished, which also removes the debt from their credit reports. At a time when federal budget uncertainties could impact healthcare access for millions, removing financial barriers to care is more important than ever. The county's investment has set an example for what local leadership can accomplish, and we are proud to be part of this work. Thank you again to Cook County for your leadership, and we look forward to continuing our work together.
Make sure I say it right. Ano-C-K, right? All right, Dennis Ano-C-K, Executive Vice President and Chief Financial Officer of St. Anthony Hospital, our new partner. Thank you.
Good morning.
Good morning.
I would really like to start by thanking President Preckwinkle and the Board of Commissioners for this bold initiative and for inviting St. Anthony's Hospital to participate at today's event. St. Anthony's Hospital is a safety net hospital, which means that our patients are disproportionately impacted by medical debt. That is why I'm here today to represent the hospital and to express our gratitude to President Preckwinkle and Cook County Board of Commissioners for leading this initiative in our region. As a community hospital, we see this initiative as a way to support the communities that we serve and the patients that seek health care at our hospital, most of whom struggle each day to meet their financial needs. More importantly, as a hospital, we believe that patients should not hesitate from seeking health care due to medical debt. Therefore, St. Anthony's Hospital is happy to partner with Cook County and Undue Medical Debt to provide debt relief to patients. Thank you very much.
Thank you. Thank you very much. And your name is? Kristen Warren. Yes, ma'am. And you are? Lainey Kleeman. All right, I'd like to thank Lainey Kleeman and Kristen Glaspar, did I do it right? Who are our sign language interpreters today. Are there any questions, Nick? Yes. Well, if you would like to speak to credit reports, we'll start with that, okay?
Yeah, I think we have anecdotal evidence from folks that have. Oh, yep, Courtney Story, Vice President, Government Initiatives at Undue Medical Debt. We have anecdotal evidence from our beneficiaries that they have had positive impacts to their credit scores, as well as we have heard from hospitals that have participated in our program, both in Cook County and in the state of Illinois, that they have seen patients return to care that otherwise were not receiving care after their medical debt was canceled. I think our newest addition is St. Anthony's. We've had the bulk of this purchase that we're announcing today was actually on the secondary market, not from hospital systems directly. But I know that we will be announcing some additional partnerships later this year that we're really excited about.
That's our hope and expectation. When we initiated the program, there was not a state program in place. And so now we have competition for eliminating medical debt. I'm grateful for it. Grateful for it. So we hope to meet our $9 million target. Okay. Yeah, can we take a picture?